So today I'm going to talk about our new test kit, the starter kit. A lot of our new practitioners always say to us, oh, we love all the material, but we just don't know where to start. There's so much material, we don't know how to integrate it into our treatments. So we've put together this starter kit, which contains quite a few diagnostic test vials, so you can work out what's going on with your patient. And it also contains a lot of the products, so the remedies that you need for the issues that you test for. So it's a complete sort of test kit in itself. So you should all have the contents list of the test kit so that you can follow where we are. Okay. So I'm going to go through the kit really and tell you what's in there. So initially, the top left-hand column, we've got the toxic metals, chemicals, and radiation diagnostic markers. So the toxic metals test vial, that's got lots and lots of toxic metals in there, including all the common ones, the sort of aluminium, mercury, nickel, all things like arsenic's in there, iron, lead is in there. And then we've got the chemicals one, which has got a lot of the chemicals from our environment which are detrimental for us. So it's got things like the chemicals that are in toiletries, in cosmetics, in pesticides, herbicides, in the food we eat. And we've got the radiation, which has the radioactive isotopes in there, so from the environment, things like uranium, strontium, and also electromagnetic stress issues in there. So they're the test vials. So you would use those from strength rather. So you put the test vial on the body from strength, and if they weaken, then toxic metals, chemicals, or radiation are an issue for the person. So then we need to look at the remedies that we've got for this toxicity. And the first one is black walnut tincture. Now this is great for detoxification, and it's also a good source of iodine. So it's good for the thyroid, it's good for balancing estrogens, and it's also good for the immune system. It acts as an antiseptic in the bronchial tubes. And we mustn't forget that it's also a great antiparasitic. So we do black walnut tincture, and it's a wonderful product, a really natural product. And about mid-September, Chris and I go off and pick the walnuts from a big estate. And we bring these back, and we pick them when they're green, just as they're turning black. And we then bring them back to our production facility, so the clean room in our big production facility, and that's where they make the black walnut tincture. So here's Chris, very proud of his crop of walnuts. He's having a good sniff of them there because the aroma is really lovely. And there's me doing all the work, all the picking. So the next remedy for toxic metals and chemicals and radiation is the coriander. We've got the coriander leaf capsule, and we've got the coriander spice capsule. And they're both great for detoxification, so you need to muscle test which one's right for your patient. The coriander spice, that's also an antioxidant. All spices have an antioxidant capability. And they're also food preservers and food flavourings. And coriander in particular is a very good source of insoluble fibre for the gut. So when you use coriander in cooking, it's quite a sort of mild flavour, so you can put several teaspoons in, and that's going to be really good as fibre for the gut. So the next remedy is lemon balm capsules. Now this is great for green people. It seems to show up really well for green people. And it's brilliant for detoxifying alpha-solanines. And alpha-solanines are a group of foods which contain, deadly nightshade foods which contain alpha-solanine, and we're going to be talking about that a bit later. Lemon balm also is great for memory. It stimulates the production of acetylcholine, so it helps us with our memory. And yarrow, that's a great detoxifier. It detoxifies all three toxins, and it shows up really well, so that's a good one to use. So we've included in here just our most common herbs and spices that are used to detox. And we've got N-acetylcysteine capsules in here too, NAC for short. And this is a great detoxifier because it detoxifies several pathways of the liver phase 2 detoxification. So it works in the glutathione pathway and in the acetylation pathway and sulfation pathway. And also cysteine, cysteine binds with the toxins and gets them out of the body. And it's also good for breaking down mucus. It's a powerful mucolytic. So if people have had a flu or an infection of some sort, then you can give them NAC to break down the resident mucus. So that's the remedies for toxins. So then we have two more diagnostic markers. We have bacteria and virus. So bacteria is a collection of all the common bacteria and virus. So virus contains all the common viruses. So you can use those from strength to weakness. So if somebody weakens to one of those, then they're suffering from an infection, either bacteria or virus. So the remedies we've selected here for the starter kit are the echinacea tincture. Well, we all know echinacea is great for the immune system. And we've also chosen the spice ginger, so ginger capsules and ginger tincture. And ginger is great for boosting up the immune system. We've also got ionic silver in here, which we label as an aqueous solution. That's for labeling requirements, but it's ionic silver liquid. And that works as a booster to the immune system. It's not a nutrient that we need in the body, but it boosts up our immune system. So the silver that we have is 10 to 16 parts per million, and it's made by electrolysis from the pure silver plate. And it works in the immune system by inhibiting catalase and stimulating myeloperoxidase, which then goes on to produce a hypochloride, which goes on to kill the bugs, the bacteria. So it's a hypochloride you need to kill the bacteria, and the silver stimulates that. Let me move on to fungus. That's another diagnostic marker. So this will contain all the common fungi. And a great remedy for fungi is coconut. So we've got coconut capsules. Coconut contains all the mid-chain fatty acids, which are good for eliminating fungus. You can use the individual ones, the sort of C8, C10, 12, 14, but it's good to have them all together, working together in a natural synergistic way, and that's what you get in coconut. We also have a tincture, pau d'arco tincture, and that's good. That's from Brazil. It's an antifungal herb, so that's good for fungus. And also, it's not actually in this position in the kit, but it's good to pick out smart zinc from further into the kit when you're testing for remedies for fungus, because zinc's great for getting rid of fungus. And also test the smart probiotics, because if you've got a good level of good bacteria in the gut, then fungus won't find it so easy to take hold. And now we've got the parasite diagnostic marker. This is a composite of the different groups of parasite. We've got the protozoa, which is a single cell, sporozoa, which is the multi-cell, then the nematode is the roundworms, trematode flatworms, and cestode hollowworms. So you probably don't need to go into too much detail with your patients as to what actually they've got, but just give them the remedy. So the remedies we've chosen for the starter, our most common remedies really for antiparasitic, is our antiparasitic formula, AP formula. And this is a combination of herbs and spices. So in there we've got wormwood, thyme, garlic, horseradish, and cayenne. And then we do the wormwood on its own. And then we have a wormwood combination. Now that contains wormwood, it contains black walnut leaf, quassia, cloves. Now cloves detach the eggs from the intestine, so that's a good thing to include in there. And we have male fern as well. Now male fern is good for detaching the heads of the parasite. The scolex, the head of the parasite, sort of claws onto the inside of the intestines. And male fern is fantastic for loosening that head of the parasite. So that's all the remedies for the different toxins and infectious diseases. So we were going to demonstrate that. See,
have you got somebody who's chemically sensitive? Okay. So how tall are you? 5'3", okay. So pop down her, yes. So at 5'3", you'd expect her to be a blue person. Yep. So we'll just check whether that's the case. So let's bend this one up to here, and you pull your knee to the shoulder. Okay, so let's go for blue. Pull. So just to make sure that she's very balanced, she's blue and blue. So I just need to take her to weakness on a temporary basis here, or strength. So let's take in the eye positions now. So what I'm going to do is, she's going to keep her head still, and you're going to follow my finger to the left. And we're going to do it 3 or 4 times, right over as far as you can get to the left. And then pull, and we've got a weakness. Okay? So that means that's a positive position. Now, when it comes to actually treating the person, you may want to do it in a particular order, but because we want to talk about chemicals, we'll do it in that position. So could we have the chemical marker? So what we can do now is either pop the chemical one here, which is the composite of the chemicals, in the clear, as we say in ours with nothing else, and she doesn't weaken to that. We can't be sure that she's got no chemicals because that other chemical hasn't got 75,000 chemicals in it. So, you know, no one marker is ever totally definitive.
Toxic metals.
Toxic metals is the next one. Pull. So she weakens to toxic metals, and if we give me radiation, let's see for good measure if she's got radiation on the well. No. So the chances are we've actually got toxic metals here which inhibit enzymes from functioning and therefore can make her highly sensitive to all sorts of things. So let's go through the remedies therefore for toxic metals.
Okay,
so we'll do
black walnut. Yeah.
So we'll try black walnut tincture, great favourite of ours. So that one works very well. Let's see if there's any other ones.
Coriander leaf.
Coriander leaf. No.
Coriander spice.
Coriander spice. So this isn't a finite group, but it's the most common ones. So that's why we put them into the kit for the common ones that
lemon
people
balm.
like to try. So lemon balm.
Lemon balm. Yarrow.
Yarrow. So we've got 2 that show us, okay? So the thing is, which one of those is the better one? Okay? So let's ask her, because I don't know the answer to that. So what we're going to do is to go to the suprachiasmatic nucleus, because that knows the answer to all things. Okay? So you put your fingers on there, and let's see what happens with the yarrow. Oh, she remains nice and strong. So now let's do the black walnut. So we know black walnut strengthens her. So let's see if that remains strong. Or no. Okay. So which one's the better one? Yarrow. Yes. Okay. So yarrow wins the day. So do we have yarrow? Shall we just do one demonstration of how to do this?
Yeah.
Jane, have you got some yarrow there?
Capsules.
Capsules? Is it capsules?
Yeah.
Okay. So what I just want to do is demonstrate how to do this. Now, you can use little glasses. The problem with capsules is they do tend to go down navel tummy button sometimes. Hold on there. So putting a little glass or those little glass Petri dishes like things on is good. So 1 capsule, we'll chuck in 2 capsules. 3 capsules. So 3 works really well there. Okay, that strengthens her. Now, when does she take it? This is the next question, isn't it? So the next question is, let's cross-challenge this now at stomach time. Stomach time is at the moment is 8 till 10. So she therapy localizes the stomach alarm point, halfway between the xiphoid and the umbilicus. and she's nice and strong. So that's a good time. Let's go small intestine time, which is lunchtime. So that's 2 o'clock till 4, and now. Okay? And let's go circulation sex time, which is 8 till 10, which is supper time. Yes. So you choose me another time. Should we go in the middle of the night? Liver time, just for a laugh. Okay. So no. So any time apart from breakfast time and supper time is not a good time. So that means she needs 3 capsules twice a day. Okay. So the best time to take a herb, if it's not too irritating, is just before food. Okay. Right. Okay. Carry on.
Yep.
Should I do a bug?
Could do, yeah.
Has anybody got a parasite that
Thank
they
you.
know?
That's great. Yeah, thank you.
Look at them all volunteer. I guarantee you half the room have got parasites. What about a sore throat? Anybody got a sore throat at the moment? Okay, let's have a sore throat then. Okay, so we'll do the same thing here. You pop yourself down on your back, and we've got somebody. You're going to tell me how tall you are, but I know what you're going to do. You're going to tell me in centimetres, aren't you? No, in feet and inches. You're going to tell me in feet and 173. What, feet? Okay, 173. So I think she should be a red. Oh. Yeah. Okay, so what she should be is a red on one eye and of course a red on the other eye. Now she's got a sore throat. Most sore throats are sort of, you tend to think it's a strep or some form of streptococcus. So if I can have the bacteria.
No, it's much better. I don't have it much, but I've been having it for 2 weeks.
Yeah, you've had it for 2 weeks.
Yeah.
And you've been ramming some vitamin C in, which is good. So let's see. So cool. So she doesn't weaken to bacteria, so we'll try a virus. Okay, now I would put my money on a virus at the moment. What was the virus I mentioned earlier? Adenovirus, of course, at this time of the year, because it's the change of the season. So she's actually got a virus. So let's go through the antivirus. Should we try echinacea?
Echinacea, yeah.
Yeah, so we'll try echinacea. Excellent, good all-rounder, that one. Good, that one works well. So next one.
Ginger capsule.
Ginger capsules. So remember what ginger heats, doesn't it? Still explain it.
Tincture,
Good
yeah.
heating spice. Of all the spices for infections, you know, that works well. Heat. You know, it makes you hot. No, no.
Ah, okay.
No, not cooking.
Silver.
It heats you up. What?
Okay.
Silver. Silver. Oh, good. See? Now we've got 3. So which is the better one? Let's ask our brain. Suprachiasmatic nucleus is part of the hypothalamus. So, silver holds well. Ooh, ginger fails the test. And echinacea fails the test. Ionic silver wins the day. Okay. So ionic silver, so we just do that.
That's it?
No. How much? Okay, so hold that. So what we do is just shoot the silver in. This is the silver, as mentioned before, which has citric acid in it to get it to work even better. So we'll go 1 squirt. You hold it. You got the meat? Don't worry about it. Okay. 2 squirts. Usually it's 5 or more, but I will just go through it. So the more frequent a person needs to take this, the more acute the problem is. If a person only shows that they need it once a day, the more chronic the problem is. They don't want to detoxify or get rid of the bug too quickly. So I think that's 5, isn't it? So it looks like 5 strengthens her. So what do we do? Same thing. What we do is we go on stomach time, okay, first of all. And she's strong on stomach. So we go on small intestine, strong on small intestine. Circulation, sex, strong. Let's take another time, shall we? Let's try heart time, sort of midday. No. So it's always accurate. Most nutrients would be at meal times, and most herbal remedies, that sort of thing, is usually between or before meals. Okay? So your dose is 5 squirts, 3 times a day before meals.
Before meals,
Yeah.
half an hour before?
No, 5-10 minutes will be enough. It's a liquid, it will go straight through. Till you're better. How long? Till you're better. Until you feel better.
Okay.
Then you can reduce the dose. That's the quickest way. Okay? Okay.
That's, yeah, I'll take that.
Okay, put some water in that and then you can have that one straight away. Okay, right. So that's how we treat fungus.
Okay. So the next section in the kit is the composite section. Now these are groups of nutrients, and they're used as a guideline so you know where to look for your patient. So we've got water-soluble vitamins, minerals, unsaturated fatty acids, coenzymes and probiotics. Now you may notice that there's no fat-soluble vitamin composite there. That's because they don't really work together in a composite. We did try it and the fat-soluble never really showed up. So if you do use the composites, you need to also pull out the fat-soluble vitamins. So you need to also test smart vitamin A oil, smart vitamin D3 oil and smart vitamin E. So you'll be testing 8 different test vials if you use the composites. So I'll just run through quickly what's in each composite. So the water-soluble vitamins, we've got the vitamin B1 there, thiamine, that's a liquid. And then we've got riboflavin 5-phosphate is a coenzyme, but it's in the vitamin composite as well, because riboflavin on its own is not very soluble, so it doesn't really work. So if any patient needs B2, then they'll get riboflavin 5-phosphate. And then we've got the B3, the niacinamide capsules, I believe they are capsules. B5 is pantothenic acid, B6 pyridoxine, folic acid, B12 hydroxycobalamin, choline, and then a couple of vitamin C products. So that's the water-soluble vitamins. The coenzymes, well, it's the coenzymes of those particular vitamins. So we've got thiamine pyrophosphate, riboflavin 5-phosphate. For the B3, there's 3 different markers for the coenzyme: NAD, NADH, NADP, and NADPH. The B6 coenzyme is pyridoxal 5-phosphate. And then the folic acid has 4 different coenzymes. So we've got folinic acid, CH2H4 folate, which is methylene tetrahydrofolate, 5-methyl tetrahydrofolate, and H4 biopterin. And then there are 2 B12 coenzymes, adenosylcobalamin and methylcobalamin. So they're all the activated Bs. As biotin is also a coenzyme. And then we've got alpha-lipoic acid, CoQ10 and vitamin C. So they're all in the coenzyme composite. So if your patient strengthens to that, then they're going to need one of those coenzymes. And the minerals, we've picked out the most common minerals that patients show to. And this is calcium, the iodides, iron, magnesium, manganese, potassium, selenium, and zinc. The unsaturated fatty acids, we've put in there the unsaturated fatty acids and their derivatives. So we've got the omega-6 ones in there. We've got linoleic acid, gamma-linolenic acid, arachidonic acid, alpha-linolenic acid, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. So they're all the fatty acids and the derivatives. So if your patient strengthens to this composite, then you'll need to look in the oil section and find which oil they need. And then there's a probiotic composite. So that's the list of probiotics in there. You can read those. They're the common probiotics. So then we get on to the vitamin section. So the first vitamin is smart vitamin A. So if your patient needs vitamin A, this is the best one to give. This is retinol palmitate in a base of organic black cumin seed. Because vitamin A is a fat-soluble vitamin, so it needs to be in a fat medium, so it needs to be in an oil. And the optimal oil for vitamin A is black cumin seed, because this provides all the activated forms of vitamin A, because vitamin A itself is retinol palmitate, but it has 3 additional activated forms. So retinol, retinal, retinoic acid. So whatever form of vitamin A your patient needs, this product, Smart Vitamin A, will give them the form they need. So you don't really need to worry too much about what type it is, because this provides all the types of vitamin A. Now here's a diagram showing this, really. We've got, from the diet, you get the retinol palmitate, that's the raw vitamin A, and then it's converted to retinol, and that is then converted on with the aid of NAD and zinc to all-trans retinal, and that's the form that's used in the eyes. But then it needs to be further converted via NAD and these two enzymes, this enzyme here, to all-trans retinoic acid. And you can see that's the one with all the functionality to it for bones and teeth, the immune system, gene transcription, for skin problems, cellular health, reproduction, and hematopoiesis, which I'm assured means the formation of red blood cells. So that's the vitamin A product, Smart Vitamin A. That comes in a small bottle, small dropper bottle, a 30 ml bottle, and it's very concentrated, so you only need a small amount. So you measure it out the same way as Chris showed. So then we've got B1. Now this is a liquid, B1 liquid. And B1 is big in energy production. That's really what you need to remember about B1, that it's used for energy production. In particular, it converts pyruvate to acetyl-CoA. And it's also used in the production of acetylcholine for memory and for the parasympathetic system. And it also detoxifies. And it's used in the synthesis of DNA and RNA. And then I'll talk about the riboflavin 5-phosphate in the coenzyme section. So we go on to B3 here, which is again in energy production, and it's involved in making hormones and neurotransmitters in the immune system, and again DNA, RNA synthesis. Then we go on to B5, again energy production and acetyl-CoA production, and it's also used in producing cartilage, so it'd be good for cartilage problems, knees, etc. And great in detoxification. B6, again, B6 is for hormones, both making them and breaking them down, and neurotransmitters, and it also works in energy production, in the recycling of proteins in the Krebs cycle. And a good telltale sign, really, is if you're short of B6, if you start to get mouth ulcers. That's a sure sign that that you need B6. And then my daughter phoned me recently and was complaining about a whole load of symptoms. And then she said, and also I'm getting mouth ulcers. So that was it. I said, right, you need to go back onto your Smart P5P. So that sorted her out. It's used in the digestive system with hydrochloric acid production, and again, detoxification. And also for skin and nails. If you get dry, flaking skin or nails, then it could be a B6 deficiency. So then we've got folic acid in the vitamin section. That's a liquid. The thing about folic acid, it's for cellular regeneration. And the sign that you may be deficient in folic acid is if your gums are receding, because that's a sign that you're not regenerating tissue. It's also a deficiency can lead to anemia, and we know about the birth defects associated with folic acid deficiency, spina bifida. And it's used in homocysteine. We'll talk about homocysteine a bit later. This recycles homocysteine. And then the B12, the raw B12, is called hydroxycobalamin. This matures red blood cells, so this helps you produce oxygen in the body. And again, that's involved in recycling homocysteine. Choline, that's a vitamin B that's produced in the gut, so by the gut bacteria. So if people don't have a good level of good bacteria in the gut, then they could be deficient in choline. And choline forms part of the cell membranes. It forms phosphatidylcholine, which then sits in the cell membranes. And it's involved in memory, the choline of acetylcholine, so you need it to make acetylcholine. Vitamin C, well, vitamin C, here we've got the vitamin C capsule, which is the straight ascorbic acid. And this is great for, it's good for the immune system, as we know, and it's good for adrenal exhaustion. But it's also involved in making collagen and in making noradrenaline. It's a great antioxidant, and it helps you absorb iron and make bile. So you either have it as a straight capsule, or we do the Smart C complex, which is a vitamin C complex. You'll see throughout the test kit that there are products that are called Smart, and these are products that we include a food substance in. So whatever vitamin and mineral we want to put into the product, we find a food substance that is rich in that particular vitamin and mineral. And this gives you the complete complex rather than just taking out part of the complex. So in the food substance, you'll have all the enzymes, catalysts, compounds and minerals that work together to give you the biological function for that particular vitamin or mineral. So in the vitamin C, we've got the ascorbic acid, which is the vitamin C, and we've got alpha lipoic acid, which recycles vitamin C. So if people need quite a high dose of vitamin C, it's good to have the alpha lipoic acid in there, because then you can take less, because vitamin C can be quite hard on the gut sometimes. Now the food substance we have in here is reishi mushroom, shiitake mushroom and beetroot. And these are all high, rich sources of the enzyme tyrosinase. Now tyrosinase is the complete vitamin C complex. And it's thought that ascorbic acid is only the protective part, so that you get more biological function from the tyrosinase. We've got rutin in there. Now rutin helps with strengthen up blood vessels. It's a permeability factor. Now the pink toothbrush is if you brush your teeth and you get a pink toothbrush from bleeding gums, then you need your capillaries strengthened up. So rutin is what you need. We have asparagine in there as well, which is a bioflavonoid, which is rich in vitamin C. So that's a great complex if people need vitamin C. Then we've got the vitamin D, Smart Vitamin D3 oil. So don't forget you'll be testing these along with the composites. So you test the composites and the vitamin A, D and E separately. So vitamin D, this is our Smart product again. It's vitamin D cholecalciferol in a base of organic black cumin seed oil. And again, this activates all the different forms of vitamin D. It's very concentrated. It's in a small bottle, so you only need a few drops. And each drop gives you 1,000 international units of vitamin D3. So here's the diagram showing D3 and its activated forms. So we get cholecalciferol from the diet, and that's stored in the liver and the muscle and the fat as 25 cholecalciferol. And that's converted in the kidney to 125 cholecalciferol. And then it's converted to 2425 cholecalciferol, which is in the prostate, testes, brain, skin, breast, colon, lungs, heart, immune cells, so everywhere really. And during our research on vitamin D, we did find that it was this activated form which was deficient in people, even if they were taking vitamin D supplements. So clearly, the supplements they were taking didn't give them this activated form. So if you use the Smart Vitamin D3 with the black cumin seed, it will make all of these activated forms. So you can go into the detail and find out which particular activated form your patient is deficient in, and that will give you the indication of the function that they're deficient in. But you can just test for the Smart Vitamin D3 as one single muscle test. Then we've got Smart Vitamin E. Now this is a combination of oils. They're all organic, and the first one is organic wheat germ oil. Now, wheat germ oil is a very high source of vitamin E, but it's also a vitamin E complex. It has all the different parts of the vitamin E complex in it. It has tocopherols and tocotrienols. It has 4 tocopherols and 4 tocotrienols. Now, most vitamin E products are alpha tocopherol or at best mixed tocopherol, but you do need the tocotrienols to get the complete vitamin E functionality. So the second oil we use is organic pistachio nut oil. Now that contains vitamin E, and particularly the gamma tocopherol. And we use organic sesame seed oil. Now this contains some vitamin E, but the main point of the sesame seed oil is it contains a compound called sesamin, which prevents the breakdown of vitamin E in the body, so it gives you a relative increase of vitamin E. So that combination together is a very good source of vitamin E. This is just what I've been saying, really. Wheat germ oil, the highest source of vitamin E, both types, and it's a complete vitamin E complex. And there's a pistachio high in gamma tocopherol. It also contains polyphenols, which have a high antioxidant capability. And sesame seed with the important compound sesamin, which inhibits this particular enzymatic process, tocopherol alpha hydroxylation. So it causes a relative increase of vitamin E in the body. And again, that contains gamma tocopherol and gamma tocotrienol. So it's a wonderful form of vitamin E. Then we've got the coenzyme section. So really, if your patient strengthens to the coenzyme composite, then they're not converting the vitamins into the activated forms. So the function really is the same as the vitamins. So the B1, the thiamine pyrophosphate, is the coenzyme of B1, and that's used in energy production, the same as the other vitamins, And we've got riboflavin 5-phosphate here, and that's used in energy production. It's used in the Krebs cycle and in the last stage of energy production, which is the electron transport. So the B2 and the B3 coenzymes work together really in energy production. Now, riboflavin 5-phosphate also has another name, flavin mononucleotide, FMN. And there's two types, FMN and FAD. These are both oxidoreductase enzymes. So they swap the electron. So you see the electron here. That's the oxidized form without the electron, and it's reduced to the addition of an electron, and the same there. So that's just the biochemistry behind it, but you can just muscle test to see if your patient strengthens to riboflavin 5-phosphate. Now the B3 coenzymes, there's two on this slide, NAD and NADH. As I said, these are used in energy production, and that's also an oxidoreductase enzyme. And the two further B3 ones, NADP and NADPH, they're the same. They swap the electron around. And they're used in the immune system. And also NADPH is good for breaking down, for metabolizing estrogens. That's the detoxification in the cytochrome P450 enzymes. Pyridoxal 5-phosphate, this is a really popular product. Lots of people test up for P5P. And in the kit, we have the liquid one. And we have also our smart one, our smart P5P. And that the food substance in there is organic rice bran. That's a very high source of P5P, and it contains all the elements that work with the P5P. So the coenzymes of folic acid, we've got 4 of them there. We've got folinic acid, which is methanyl H4-folate, the CH2H4-folate, methylene tetrahydrofolate, 5-methyl tetrahydrofolate, and H4-biopterin. So your patient could strengthen to any one of those because they're all folic acid coenzymes. And they're all products as well, so you can just give the product if they strengthen. And that's what it's used for, as we spoke about earlier. Now these are the coenzymes of B12. That's the raw B12 there, the hydroxycobalamin. One of the coenzymes is methylcobalamin, and that's used in methylation and also in the breakdown of homocysteine. And then we have adenosylcobalamin down here, which is used in energy production and the maturation of red blood cells. So you see succinyl-CoA is in the Krebs cycle. There we go. So a deficiency of adenosylcobalamin can lead to macrocytic anemia. And it also burns fatty acid C3 in the Krebs cycle as energy production. Methylcobalamin recycles homocysteine, and it deals with a deficiency will lead to methylation defects. So methylation is used to detoxify, and it's used to break down hormones and break down neurotransmitters. And it also keeps the caps on the genes. So if you don't want bad parts of the genes to be exposed, you need lots of methylation to keep the caps on those genes. Biotin is important because it breaks down ammonia, and ammonia is very damaging to the brain and to the kidneys, so you want to help your patients if they're high in ammonia. And it's used in the energy pathway. It breaks down and makes fatty acids. Alpha-lipoic acid, again, in energy production and in glucose metabolism. And it's also a good detoxifier of toxic metals, so you could test it back when you're looking at toxins, really. You could add that to your list. Of coenzyme Q10. Now, our coenzyme Q10 is the ubiquinone form, which is the form that's in the mitochondria, and that converts to ubiquinol in the body, which is the antioxidant. And this is used in the energy production, in the last phase of energy production, the electron transport. So if people have low energy, they could be short of CoQ10 in this last stage of energy production, because it carries the electrons from complex 1 and 2 on to complex 3. Which then produces the energy after complex 4. And CoQ10 is inhibited by statins, so if you have patients on statins, you may want to supplement with CoQ10. Then we have a B complex, which has all the Bs in. Some of them are activated, and it contains zinc and magnesium. So it's a great product for energy production, because as we went through the vitamins and coenzymes, lots of them are involved, the B vitamins are involved in energy production. So that's a great multiple to give to people for energy. We're also finding it's very good for the endocrine system, so for the thyroid or the adrenals, and it's also a good maintenance product. It's also good to take away on holiday, because I think if you do a bit too much partying, then a bit of B complex the next day is a good thing. I give it to my son when he goes away. Oh yes, and it's also good for preventing mosquito bites. If you're the person that gets bitten in the group, then you should take B complex, because that will, I think you give off some kind of odor which nobody else can smell except the mosquitoes, and it keeps the bugs away. So this is just to illustrate really how important the B vitamins are in the energy production. You can see here in this first phase here, the glycolysis phase, with this B3 there, and then between pyruvate acetyl-CoA, you've got B1, B2, B3, alpha-lipoic acid. And then in the Krebs cycle, we've got B1, B2, B3, B5. So the B complex is a great thing to give for energy production. Okay, now we're into the multiple section. We've got multiples based on the body types. So we did some research and discovered that certain body types need certain vitamins and minerals. So this is the selection for the blue. We've got the blue complex, the green complex, and the red complex. So that's a great maintenance product for people and specific to their body type, which is good. Then we've got the minerals section. So we picked out the common minerals here, and the first one is smart calcium. So we find that the best forms of calcium to work in the body are citrate and lactate. So we've mixed those two with arrowroot. That's calcium. We all know that calcium is great for building bones and teeth and nails, but it's also good for neuromuscular contraction. The smart iodide, this is great for the thyroid, and we've also found it very good as an antiparasitic, so you may want to test that when people get parasites. Our combination, the food element is the sea vegetable and the nettle leaf. That's got all the enzymes and compounds in. And we've got magnesium iodide and potassium iodide in it. So what iodine does is it synthesizes, it makes T4 and it converts T4 to T3. And it also produces the hypoiodide in the immune system. And it's great for balancing the female hormones, estradiol-estrone ratio. Our iron is a combination, it's a liquid, it's a combination of chloride and sulfate. And that's great in, obviously, for hemoglobin production to prevent anemia, microcytic anemia. And also we need iron for all the heme enzymes. Now, there's lots of heme enzymes in the body. It seems to regulate a lot of body systems. You've got the cytochrome C enzyme, which is in the energy production. The cytochrome P450, which is for detoxification. In the immune system, it's part of the catalase enzyme. So it's really heme's used all over the body. So it's really important mineral to have enough of. And also in hair, if you're losing your hair, that could be a symptom of iron deficiency. Iron bonds with an amino acid and produces transferrin. So if you don't have enough iron, then you're going to possibly start losing the hair. Smart magnesium, we use buckwheat as the food substance. And the two types of magnesium that we find work really well with the majority of people are ascorbate and citrate, and they work really well in synergy together. Magnesium, well, a huge amount of enzymes in the body use magnesium as a cofactor. It regulates the synthesis of carbohydrates and energy, and again, it's involved in the heme production, so really important. It's involved in RNA and DNA and in making the coenzymes. It's also used in the phospholipids for the cell membranes, and it's used for the heart and muscle contraction. So magnesium is one to check with heart issues. There's also magnesium deficiency can lead to excessive sweating and excessive body odor. So if people have that problem, it could be magnesium deficiency. And if not magnesium, it may be zinc. So it's worth checking both. For the manganese that we have in the kit is manganese citrate, and we find that works really well with the majority of people. Manganese is great for the thyroid. It also strengthens up collagen. This was discovered when chickens developed slip tendon disease and they couldn't run anymore because their tendons had slipped down over their feet. So they needed manganese. That was their deficiency. If you get trigger finger, which is where you can't straighten out your finger, then it could be manganese. And it's really good for intervertebral discs. And it's a cofactor in the Krebs cycle for energy and thyroid. And the potassium we've got the food substance is alfalfa, that's a rich source of potassium. And the two types are sulfate and chloride. Now, smart potassium is useful if people have got high blood pressure, and also as a diuretic if they're retaining water. And it also regulates heart rhythm, so if people have problems with the heart, then try smart potassium. Selenium liquid, our form we've got in the kit is sodium selenate. Now, selenium has three different functions. It's used in detoxification with the glutathione peroxidase enzyme, and it's used by the thyroid, converting T4 to T3. And it's also good for anti-aging. It stops methionine being oxidized to produce methionine sulfoxide. So if you want to stay young and beautiful, make sure you have enough selenium. And it also inhibits viral replication, so it's good if you've got a virus to take selenium. Now the zinc's a really popular product. The majority of people are deficient in zinc. And the combination that we find is really, really good is ascorbate, citrate and picolinate together. The majority of people will strengthen to that. And the food source there is celery seed. So zinc's really, really important in the body. The total body amount is 1.4 to 2 grams. The highest amounts are found in the placenta, the choroid of the eye, prostate, liver, kidney, muscle, heart, pancreas, spleen, testes and brain. So really everywhere. Everywhere needs zinc. And there's 100 zinc enzymes that are essential for the growth and repair of tissue. So DNA polymerase, which makes DNA, allows us to repair tissue, that's a zinc-dependent enzyme. So if people aren't repairing, then zinc is what you need to give them. So if you're deficient in zinc, then you can't produce the DNA and RNA to repair. Zinc is important in taste. Gustin is the major protein found in saliva, and that contains zinc. So people with taste and smell dysfunction are going to be deficient in zinc. And also it's a cause of poor appetite, I think particularly in children. If your children have a poor appetite, then they're probably zinc deficient. So now we're on to the oil section. Starting with borage oil. Well, all our plant oils are cold-pressed organic oils. They've not been chemically processed at all, and they are steeped in watercress. Now we do this because watercress contains an enzyme called phospholipase A, and this enzyme cleaves out the damaged part of the cell membranes, and then it can be replaced with the good oil. And watercress also contains selenium, which is a cofactor of that particular enzyme, so that all works perfectly well together. And they're all in beautiful mirror glass, which protects them from going rancid, and also gives them energy, energizes them. So we have two GLA-rich oils in the kit. We have borage oil and evening primrose. Now these are particularly good for female hormone problems, for skin problems, and they're also good for producing the anti-inflammatory PGE1. We have omega-3 rich oils in there. We have flaxseed oil, which is a high source of omega-3, that's about 60%. We have pumpkin seed oil, which is 10%, so that's a good mix of omega-3 and omega-6. Walnut is 10% omega-3. And we have the super omega-3 at 55%. Now this is fish oil. It's a good quality fish oil, but it's probably not wise to give it to blue people because of the possible trace of mercury in there, and blue people's affinity to mercury. So omega-3 is great for blood thinning, for producing the anti-inflammatory prostaglandins 3, and it's also good for the brain. The brain phospholipids rely on omega-3 oils. We've got wheat germ oil in there on its own. It is part of the smart vitamin E, but it also tests well on its own for some people. We've talked about that being a good source of vitamin E. Now we've got the smart thinking oil. Now this came out of our research into dementia and memory loss. It's a combination of pumpkin seed oil and rapeseed oil with some vitamin E in there. Now the rapeseed oil we use is a really good quality rapeseed oil. It's unrefined, organic, and it's cold pressed and GM free. And it has a high ratio of omega-3 to omega-6, so it's 3 to 1, 3 omega-6 to 1 omega-3. And there's been lots of research done to show that rapeseed oil does help you make DHA. Now DHA is the fatty acid that you need in the brain. So that's why this is called the smart thinking oil, because it helps you with brain function and helps guard against memory loss and dementia. So in order to produce the DHA in the body, by taking this smart thinking oil, you've got the omega-3 in the rapeseed oil, and the pumpkin seed provides an enzyme which encourages the conversion of DPA to DHA, and that's the delta-4 desaturase enzyme. So this stimulates the conversion of omega-3 to DHA. So you've got two food substances there that together are working to produce the fatty acids you need in the brain, which is DHA. You also need DHA in the skin and in some endocrine organs as well. And then the Wonder Oil, that was our first blend of oils. It's organic peanut oil and sesame seed mixed together. And that still tests really well, so that's worth testing on your patients. There is peanut oil in there. It's normally the proteins that people are allergic to, but I think if anybody has a problem with peanut, just choose one of the other oils, really, probably the wisest thing to do. Then we have the body type oils, body type combinations. So the blue combination is flaxseed, pumpkin and walnut, which is a fairly high omega-3 compound mixture combination. And the green Wonder Oil, that's more of an omega-6 combination. And then the red is a mix of 3 and 6 and also 9 with the olive oil in there. So that's the particular oils we found each body type required. And then the last product in this section is the Smart Probiotic. Now there's just one probiotic product in the test kit, and this is the combination of all our probiotics together, because we find that shows up most frequently for people. So that's a great product if people are short in good bacteria. Then we have a few specialty products, as we call them. We've got Smart Adrenal, which is bovine tissue extract. And this is really good if people are adrenally exhausted. Now it is bovine, so vegetarians may or may not want to take it. It is also a rich source of cardiolipin, and that's the main phospholipid in the heart and also in the mitochondria of every cell. So that's a really good source of cardiolipin. Because heart is another source of cardiolipin. I remember when I was studied in France for a while, I lived in a hall of residence. And the only time that you could see a lot of meat is you go into the canteen, you queued up for dinner, and whenever you could see lots and lots of meat, oh great, it's a great big dinner tonight. And you'd get there and it would be heart. So they eat heart a lot on the continent. And it's something we don't really eat in this country, I think. But it's probably really, really healthy. So this is an antihistamine product. So we're coming up to hay fever season. So this would be a great product to give those hay fever sufferers. It's a good antihistamine. It's a blend of vitamin C, ascorbic acid, with hesperidin, which is a bioflavonoid, which is really good for breaking down histamine. And paprika sort of is a spice which boosts up the immune system, boosts up the breakdown of histamine. And thiamine gives you that energy burst to break down the histamine. So that's a good combination product. And we have smart homocysteine product. We've got homocysteine as a test vial further on, which we'll talk about. But the quick and effective way to treat high levels of homocysteine is to use the smart homocysteine product, because in there are all the vitamins needed to break down homocysteine. And we also have in there beetroot, which is a food substance in there, and that contains serine, which helps to break down homocysteine as well. So that's a good all-round product for breaking down homocysteine. Bone formula, so if people are worried about osteoporosis or if they've had a bone fracture, then it's good to take bone formula. And the smart turmeric capsules, this is a great antioxidant, smart turmeric, and it's good for regrowth. It's got a lot of research looked into it about regrowth of brain cells, so neurogenesis. So it's good for memory and for preventing dementia. And it's also great for energy production because it protects that last vital part of the energy production system at complex 4. So that's a great product. And we combine it with freshly ground organic black cumin seed. And that allows the absorption of turmeric into the gut, so it works much better, and you could take less. That's really, really important that if you take turmeric, it's organic, because I think spices are probably heavily sprayed and have heavy amounts of pesticide in there. So really, you don't want to be giving people pesticides. So go for the organic turmeric. And we did find when we did our research that if we used turmeric that wasn't organic, it didn't strengthen anyway. So it's really not worth using it at all, and it could possibly be detrimental. So always go for the organic turmeric with the black cumin seed. Okay.